Well, welcome everyone. I'm glad that you're able to join us today. My name is Dan Bromberg. I'm the Director of Academic Programs for the Carsey School of Policy. And I'm joined today by Carolyn Arcand, one of our faculty members in the program, or in the school, I should say, because she actually teaches in a number of programs. So we invited Carolyn here to chat about the courses she'll be teaching in the spring. But before we do that, I'll just give a quick overview of what the Carsey School offers. We have three academic programs, three graduate programs. We have a graduate program in public administration. We have a graduate program in public policy, and we have a graduate program in community development. And they're all public service facing degrees. Each of them offers slightly different, a slightly different curriculum that really tackles a different part of the public policy process. We think about the MPP as development and advocacy of public policy, understanding, how policy is made, how one can communicate policy, analyze policy. We think about public administration as more of the implementation of public policy. So after policy is, passed through a legislature, at some point that needs to be implemented. So that program really focuses on, how do we do that? What do managers look like in both the public and nonprofit sector when they're implementing these various policy initiatives? And the Masters of Community Development really looks much more at the project level, I would say, and kind of a grassroots, growth of public policy from the ground up. How do we get community involvement for programs? How do we get all stakeholders' voices heard? And the beauty of these three programs is they really do cross over with each other and support each other quite well. So the course that we're actually talking about today is a course that is appropriate for all three of our programs. I believe this semester it's going to be geared more towards the public policy side. And we're going to be talking about a course that's titled Care Work, Public Policy, and COVID-19. And this is a course, Carolyn, that I know kind of grew out of a care economy course that you had taught previously. So maybe you can kind of talk about that a little bit, just your thinking and the initial design of this course. And then maybe we could talk about how it's changed through the years.
Yeah, absolutely. So I have taught a few courses in the past about the impact of public policy on the provision of care in our economy. And I think one contextual piece that's important to think about and that we talk about in the course is when I talk about the impact of policy on care workers, it's impossible to lump care workers into one category and say, well, how are care workers as a group impacted by policy? Instead, we need to start by thinking about the different places that care work happens, the different forms of care that exist, and the different characteristics of people who provide care. And I can talk a little bit kind of about where we go with that in my courses. When I say care work, people oftentimes think of kind of the interactive face-to-face care that happens with, a parent feeding a child or, a physical therapist providing therapy to help someone recover from an injury. But care work more broadly can refer to the supportive work that enables that face-to-face interaction to happen. So when we think about the work that's done in a hospital, we think about doctors and nurses and social workers providing that interactive care. But there's actually this network of support workers who are also considered care workers, who are preparing meals and cleaning the facility and doing laundry and stocking supplies. So that support work needs to happen to actually support that interactive care. So that's one thing we consider. Another thing we talk about is the fact that a lot of care work is unpaid and takes place in private households, between family and friends. And there's also paid care work. People work for organizations. A lot of our students work for organizations that provide care work in places like hospitals, but also nursing homes, daycare centers. There's also this really neat intersection of paid care workers who enter private homes. So nannies and, housekeepers and home health aides. So there are all these different places where care work happens. Some of it's paid, some of it's unpaid. And when we look at the workers who provide this type of care, there are important differences along lines of things like gender and race and age and education level that all matter in terms of public policy and whether public policy either supports your ability to provide care or constrains your options in terms of the work that you do and how much you're paid and labor policy relevant to the work that you do. So in my prior classes and in this upcoming class, we're going to learn a method of policy analysis called intersectionality-based policy analysis. And that'll help us understand how policies are experienced differently based on where the care takes place and the characteristics of the caregiver, with a goal of creating more equitable policies and promoting social justice. So this class has kind of grown out of that approach and that kind of appreciation of the different places that care happens across our economy and different characteristics of care workers. And right now is a really interesting time because we're seeing how COVID-19 has impacted the way that care is performed, unpaid care in the economy, and there's a lot of overlap that we're seeing that care scholars have always talked about, but that's becoming much more seen at the policy level right now.
Yeah, that's awesome. Thank you. That's I think really helpful. So if I'm kind of sitting on the outside and I'm hearing you talk about all of these different types of care work, you know, I could get to a point where I'd say, okay, I could understand how public policy might, you know, affect some of these things. Could you give us an example of like, what would a policy look like that would actually have an effect on care work? And what's that connection there that you're going to kind of draw in the classroom?
Yeah, so I guess one example, or kind of a primary example, is the Family and Medical Leave Act, which is about almost 25 years old at this point, but that provides people with up to 12 weeks of unpaid leave, where you can take leave to care for yourself or a family member who's experiencing illness. You can take leave for the birth of a child or the adoption of a child. And certainly characteristics of the type of job that you do are going to impact your ability to take leave under the Family and Medical Leave Act. Whether you have savings to support unpaid leave will support whether or not you can take that leave, or whether you have someone else in your household who will continue to work when you take that leave. And certainly the characteristics of the job that you do will impact whether or not you have access to that policy. For example, the policy only applies to workers who have worked a certain number of hours for their employer in the past year. So if you're combining multiple part-time jobs, you're not going to qualify. So your ability to access that policy to provide unpaid care is impacted by the type of work that you do, your income level, characteristics such as that. And so interestingly, with COVID, there has been a lot of advocacy for, well, we should have paid leave for workers so that everyone can benefit. And with COVID, you know, we did see a federal policy pass, the Families First Coronavirus Response Act, which now we do have access to paid leave in this moment in time. If you do contract COVID or need to quarantine, you can access up to 2 weeks of paid leave and up to 10 weeks for childcare emergencies. So if your daycare closed, and we're going to be talking about who has access to that policy, the extent to which people are able to take advantage of that policy, and the time limitations on that policy. That was really useful in March and April. Maybe not so much if you've timed out and you still don't have daycare, and your school is closed and you need to take care of your kids while also working from home, if that's a possibility for you. So there are all sorts of these interesting overlaps in terms of the type of work that you do, the type of unpaid care that you provide, and the way that policy interacts with that.
So really interesting stuff. A slight delay for the folks listening. Yeah, really interesting. I mean, I think, you know, so obviously some of these policies, as you mentioned, could time out right now. I kind of wonder, you know, if some of these things were in the policy playbook already, you know, prior to COVID, you know, and these were policies that people might have been advocating for, you know, prior to COVID, and COVID kind of opens that window, which is, you know, an interesting kind of take, and, you know, obviously policy entrepreneurship to some degree.
Yeah, absolutely. And I mean, what we're seeing now with the fact that, okay, all of a sudden these policies have come into play in terms of paid sick leave, is this something that now that we know it's possible, will this stick around after COVID? And, at the federal level, that's a question. At the state level, we've seen states, to different extents, support paid sick leave or paid family and medical leave. We've also seen different local policies come into play in terms of things like access to time off or access to even things like, PPE, personal protective equipment. So there's a lot of interplay between the different levels of policymaking that impact people in the work that they do that may or may not stick around after COVID. And with this being an emerging policy issue, we're going to be what we talk about today. Things might have changed by the time I'm teaching this course in the spring semester. So one challenge here is to tap into these sources of information about policy change at these different levels of government and be following that impact.
Yeah, really cool. So I think, it's so great that you're building this class around what we're kind of going through on a daily basis. So obviously that takes a lot of work. So thanks for doing that and providing that to, all of our students. Carolyn teaches a handful of classes in both of our programs. This is just one that I think is, closer aligned with some of your research interests. So really exciting that, we get to roll this course out during this time. Just a couple points to make. We're joined by our colleague, Robin Hustledge, who is going to help us answer any questions that might arise. And I think Robin had mentioned, if you have any, you could throw them in the Q&A or the chat at the bottom of the screen. Carolyn and I are happy to stick around, answer questions about the course specifically or about, any of our programs. So if there are any questions, we're happy to stick around and help out. And thank you so much, Carolyn, for taking some time and for working on this course. I'm really looking forward to it. Oh, Robin, I think you're muted.
Thank you for that. There are a few questions. A question for Carolyn about the format of your course. Is it online? Is it synchronous, asynchronous, or a hybrid course?
Yeah, so we're going to have kind of a hybrid format for this course. So there's a lot of great written material on the topic. There are some fascinating documentaries about the lived experiences of coworkers or of care workers. So we'll be building off of some recorded lecture material, and I think I'm hoping to even have a panel of care workers come and talk about their particular experiences and kind of overlaying COVID on that. But necessarily this topic is going to involve a lot of discussion and reflection of personal experiences with caregiving and understanding of care, the care economy. So there will be discussion groups as part of the course. There will be some synchronous, some asynchronous, and there will be research projects where students are researching topics of interest as they relate to caregiving, COVID, and policy, and talking about what they've been learning with classmates and with the class as a whole.
Great. Another question is, how will you explore emergent issues and new developments related to care work, policy, and COVID-19 as a class?
Yeah, so that's the challenge with something that's an ongoing, the pandemic is ongoing and the policy response is ongoing. So I'm working closely with the UNH library now, and I can't speak highly enough about the librarians there. We're creating a research guide where we're going to be compiling the most recent academic and think tank and research institute research on these issues of care, COVID, and policy, and also kind of linking us to sources of new policy on these topics. So we're going to be compiling a source for the class to use collectively as we research this topic.
Great. Another question is, as a student, will I be able to explore my own interests, in care work and policy as it relates to COVID-19?
Yeah, so there is a broad range here, and I think this course is appropriate for both public policy students and students of public administration who might work in certain areas of caregiving, or who might be interested in exploring unpaid care as it relates to their lives or their experiences. So we define care work, care scholars define care work quite broadly. So whether your interest is in that direct interactive care work that's performed between doctors and patients or childcare providers and children, that's great. But there's also this broader kind of question of, well, there's a lot of essential work being performed during this pandemic. People who are, providing, grocery store, staffing grocery stores and providing the work on the ground of, Meals on Wheels to, as in nonprofits. So there's a wide spectrum of opportunity to explore your own specific interests in caregiving and the overlay of policy and COVID on top of that. So broadly conceived, we'll be talking about care work policy and COVID.
Great. Looks like we have some program questions, Dan. The question is, when can I start the MPA program? That must be the program of interest. Can they start in the spring or summer terms in addition to traditional fall?
Sure, and I apologize. There's probably some background noise, so if you're picking that up, my apologies. They could start whenever they'd like. The truth is, this program is built so there is what I would say a sequence of courses which is helpful, but every semester, with proper advising, you could get rolling and really pick up onto that sequence at any point. So we do have a spring enrollment, we do have a summer enrollment, and we do have a fall enrollment. Our classes typically run as 8-week sessions, and moving forward, they're going to typically be running as 8-week online sessions. So both Carolyn and I serve as advisors. We would probably just chat with you and say, okay, you're starting in the summer. This is a good course to get you moving, or you're starting in the fall and spring. One of these courses make a lot of sense. So, yep, it is completely open to the desires.
Great. So the next question is, if I wanted to start in the spring, what is the application deadline, and does the application require the GRE?
So the application does not require the GRE. Our deadline is December 15th for the spring semester. And what that really means is you need to get started prior to that December 15th date. Ideally, you have a good amount in, prior to December 15th. But if there's something hanging, a letter of recommendation or, a transcript that hasn't gotten to us and it gets to us within the days after December 15th, we'll obviously work with you. So we try to keep it tight to that December 15th deadline, though.
How big are MPA classes, and are there cohorts of students? How does that work?
So because students could enter at any point during the year, there's not what you would call a traditional cohort. That said, we do have waves of students that enter around the same time. Moving forward to more of an online option, which we'll be doing in the spring and fall, you will see more of a cohort model emerge because students, for example, could start in the fall and they'll be finishing within a year's time. So they'll, ideally be moving through together. The fact that it's a part-time basis, though, does change that. So students do move at their own pace. The number of students in classes vary. So I'll give you an example. I'm teaching our Foundations of Theories class, right? So that's kind of our first introductory class. I have about 18 students in that class, which I would say is a pretty typical size for that type of class. When Carolyn teaches a stats class, it might actually grow larger than that because there might be students from a public health program or a political science program that might be interested in that. What is important to know is that our classes reserve spaces for our students first. So you'll never be blocked out of a public administration or public policy class. And rarely do those classes go much above 20. Typically we're in the 10 to 15, maybe 15 to 20 range.
Great. One last question is, can I take courses in any of the programs that Carsey offers as an elective in the MPA, or if I were in the MCD program?
Yeah. So each of the programs has a different structure. The Masters of Community Development program is probably the most structured out of all three of our programs, where there is a pretty clear sequence and fewer elective options. I believe there are 3 electives in total in MCD. And whereas public administration has 5 electives, potentially 3 if you're in the executive arm of that program, and public policy has, depending, around 4 electives. You are more than welcome to take any course in, any one of our programs to fulfill those electives. You might even, have a conversation with your advisor, and it's possible you might fulfill one of the core requirements in another program. So an example of that is we have a strategy and communications track in our Masters of Public Policy program. We teach a negotiations class in our Masters of Public Administration program. That course counts as a track requirement in the MPP. So there are always opportunities, and it's just a matter of chatting with your advisor, and they could kind of help you piece that together.
Great. That's all the questions I see.
Okay, excellent. Well, thank you everyone for joining us today. And thank you so much, Carolyn, for joining us today. I honestly really looking forward to the course. I'm so thrilled that I'm able to offer it and that, you're able to offer it. It will be scheduled most likely, not until March of 2021, apologies. So it'll be starting in March and ending in May. So that gives people plenty of time to look into this and sign up for this course. And it also gives, I think, Carolyn, a good amount of time to keep gathering, this ongoing emerging situation. So, a lot of that will be embedded in there. So thanks, everyone. Take care.